So with fetal circulation, all the necessary nutrients, oxygen, and life support from the mother's blood goes through the placenta and to the baby through blood vessels in the umbilical cord. Waste products and carbon dioxide from the baby are sent back through the umbilical cord vessels or the arteries in placenta to the mother's circulation to be eliminated. In a typical cord, you're going to have 2 arteries and 1 vein. While the baby is still in the uterus, the lungs aren't being used. The baby's liver is not fully developed, and circulating blood bypasses the lungs and liver by flowing in different pathways through special openings called shunts. We have a PDA, or patent ductus arteriosus, and then you have a foramen ovale, which is right here. The oxygen and nutrients from the mother's blood are transferred across the placenta to the fetus through the umbilical cord. And then this oxygenated and nutrient-filled blood flows through the umbilical vein towards the baby's liver, and there it moves through a shunt called the ductus venosus. This allows some of the blood to go to the liver, but most of this highly oxygenated blood flows to a large vessel called the inferior vena cava and then into the right atrium of the heart. When oxygenated blood from the mother enters the right side of the heart, it flows into the upper chamber of the right atrium. Most of the blood flows across to the left atrium through the shunt called the foramen ovale. And then from the left atrium, blood moves down to the left ventricle. It's then pumped into the first part of the large artery coming from the heart, or the ascending aorta. From the aorta, the oxygen-rich blood is sent to the brain and to the heart muscle itself. Blood is also sent to the lower body. So very little is getting to the lungs during fetal circulation. Blood returning to the heart from the fetal body contains carbon dioxide and waste products as it enters the right atrium. It flows down to the right ventricle, where it normally would be sent to the lungs to be oxygenated, but instead it bypasses the lungs and flows through the ductus arteriosus into the descending aorta, which connects to the umbilical arteries. From there, blood flows back into the placenta. There, the carbon dioxide and waste products are released into the mother's circulatory system, and the oxygen and nutrients from the mother's blood are transferred across the placenta, and the cycle starts again. When birth happens, a lot of changes take place, and the umbilical cord is clamped, and the baby no longer receives oxygen and nutrients from the mother. And with the baby's first few breaths, the lungs start to expand, and the ductus arteriosus and foramen ovale are supposed to close, and the baby's circulation and blood flow through the heart now functions like ours. So here is your normal blood circulation, which we all know. So when a baby's born, we typically do some what we call delayed cord clamping.